Al and Pam live amongst the pine trees in central Florida near the city of Melbourne. The roof over their heads is a blue tarp.
I'm gonna just live here.
They have been here for a year, ever since the owner of the apartment they lived in more than doubled their rent. They couldn't afford that on the money Al makes working in landscaping. Pam has health issues and does not work.
Oh yeah, I work every day, man. I can't stay home.
They say they like it out here, except when the summer thunderstorms blow in the rain and the occasional thief comes by. With COVID-19, Al and Pam say being isolated is kind of a blessing.
Do you worry at all about the virus?
Oh, not really, because we keep to ourselves. We stay in the woods all day long unless I'm working. Where I worried is where I work. That's where everybody is, and some have more, some don't.
I let God take care of it. Put all my trust and faith in God. That's all you can do.
This part of Florida along the East Coast is dotted with homeless camps. Like Al and Pam, Herbie lives in the woods too, alone and away from strangers.
This is my kingdom. He calls it paradise. This is paradise. I got birds coming here every now and then. I said, man, where are these birds coming from? I mean, this is a beautiful spot.
There are, according to the U.S. government statistics, 28,000 homeless in Florida, the third highest number in the nation behind California and New York. Considered one of the most high-risk groups in the country, agencies and organizations that aid the homeless are doing things they never did before in order to reduce the risk and stop the spread of COVID-19. At Daily Bread, the largest homeless outreach center in Brevard County, everyone on the property is required to wear a mask, and masks are handed out to the homeless. The 175 meals they serve a day are now all prepackaged, and there is a major effort underway to test the homeless for the virus. The Brevard Health Alliance set up a mobile testing site.
Ready?
Al Gardner used to be a security guard in Miami. He's living on the street now. He was one of the first to sign up for a test, and he says he always wears a mask.
Everybody got to do it because you never know. I'm diabetic, and I can easily get sick, but I have to wear it.
Would that be your greatest fear as a healthcare professional? An outbreak of COVID in a camp?
Yes, because our population tend to migrate throughout Brevard County. They may use Daily Bread services one day and go up north to another service location that provides showers, food, or clothing. And then there's exposure that keeps moving throughout Brevard County. So it's important for us to know with this population where they're at. We're able to contact them. We're able to get them to quarantine. Is your address here at Daily Bread?
Yes.
Because the homeless population is so transient, the test results go to Daily Bread, which passes them on to the individuals. Testing is hugely important, with the number of cases rising daily. Of the 67 counties in Florida, Brevard consistently ranks in the top 15 for cases. During the first 4 months of the pandemic, the total was more than 4,200. Jeff Noose is executive director of Daily Bread.
That would have to be a huge concern that if there were an outbreak in one of these camps.
People experiencing homelessness are dealing with an added vulnerability in every health issue. In a circumstance like this, there's tremendous vulnerability. If somebody gets sick, they might have an underlying health concern in the homeless community. There are the issues of diabetes, that is, and COPD and other things that complicate treatment of the virus and susceptibility to the virus.
Where do you live? Pretty much on the streets here and there. I kind of move around.
Jerry Olette is in that high-risk group. He's been tested 3 times for COVID-19. So far, all negative.
I got acute kidney failure, so that was low. My potassium was low. My white blood cell count was low.
What about the hygiene, though? I mean, because that's an issue, too, right? I mean, and that's part and parcel. Yeah, you tell me to go wash my hands and use Purell, I can do it.
That's right.
They don't have that luxury.
But it is a challenge. We can't tell people to wash their hands without providing that place to do it. We can't tell people to stay at home if they don't have a home. We have to find creative ways of addressing this issue for the homeless population.
One way, at Mosaic Church in Palm Bay, Florida, they bring in portable showers.
How you feel, CJ? You look better.
Feel better. How often do you come here? Every week, every Saturday.
After each shower, the stall is sanitized, the walls wiped down. Here at the church, they also provide hygiene kits with soap, deodorant, washcloths, and other essentials.
Socks, toothbrush, toothpaste, Band-Aids, bug spray.
So far, the homeless population in Brevard County does not appear to be overly affected by COVID-19. One of the reasons for that may well be that different organizations, including Daily Bread, are twice a week delivering food and supplies to people in their camps, which is keeping them out of stores. And there's something else. Palm Bay police officer David Porter, who checks up on those in his jurisdiction, believes how they live may to some extent be shielding them from the infection.
One benefit is they're out in the open. You know, they're not confined inside, good or bad.
And it's not just in Florida. Cities in Texas, Arizona, and Oregon, for instance, say the homeless population is faring better than anyone expected. Yes, there have been cases, but the numbers are low. Here's what they are saying in Portland, Oregon.
There's a lot to unpack, but we'll start with this. Point blank, there has not been a documented outbreak of COVID-19 among Portland's homeless.
Agencies and organizations that care for the homeless and underserved communities believe they've been able to keep the virus in check because they were proactive from the beginning of the pandemic. They put plans in place early on to isolate COVID-positive individuals and to get out in front of testing. The Brevard Health Alliance set up this drive-through site, which goes from location to location around the county. 800 tests were given to the county's poor during one 4-event period. Sadly, there is another worry beyond health that these groups are fearing could overwhelm them. Listen to this from the Coalition for the Homeless in New York.
The COVID-19 pandemic has devastated our city, causing more New Yorkers to lose their homes and even more to end up on our streets.
Unemployed Americans losing everything could create a surge of new homelessness.
Do you worry about budget and finances with considering the damage that COVID's done to the economy?
Mm-hmm. Yes, we're concerned about the impact. It's the two waves of this crisis, the health crisis and then the economic crisis. We're concerned that there's going to be a wave of homelessness. Some people in the homeless services sector have talked about a tsunami of homelessness.
Kara Beard works for Daily Bread, finding housing for homeless clients. What she's witnessed is troubling.
I was walking through Daily Bread just the other day, and I came back in and talked to my coworker, and I said, how come I'm walking out there? I don't recognize anybody. And normally I walk through there and I know 90% of the people that are there, but I walked out the other day and it was every single person. I had never seen them before. So it seems like we are already seeing newly homeless.
While it is difficult to find anything positive in the midst of this pandemic, one thing is pretty clear. The homeless seem to get it. Just ask Jerry Olette.
If I want to die, I want to make sure it's of old age.